Welcome back to Cheddar's Opening Bell, everyone. This next segment is part of our ongoing Suspended series where we examine classrooms in crisis. And today we're taking a look at colleges as they address their plans for the fall semester. Joining me now is Dr. Ali Rezai, Executive Chair of West Virginia University's Rockefeller Neuroscience Institute. Doctor, it's great to have you with us today. How is your university trying to track and prevent the spread of COVID-19?
So our university is deploying a number of strategies looking at testing of students and faculty, as well as doing daily surveys for healthness and wellness, as well as requiring the wearing of masks, social distancing, washing your hands, and also limiting the number of people that can gather together in the dormitories, classes, athletics, and other facilities. Mm-hmm. In addition to that, we're deploying a new technology that uses a wearable ring, for example, and an app that you put on your phone that allows us to predict the onset of viral symptoms, as well as a new way of helping people be more empowered when they get back to school and be more in charge of their bodies.
Okay, talk to us more about that app and whether or not it's optional for students.
This is right now, it's a research study that we're doing based on, we've been looking for the past 5 months, over 1,000 individuals, healthcare workers, frontline personnel, National Guard, and others, helping understand how your body is being impacted during this very important asymptomatic phase of the disease, where you're infected by the virus, but you're not exhibiting the symptoms of it. And this happens 2 to 5 days before you actually have the symptoms. So it's a very critical period that you're spreading the infection, but you don't know of it. So what happens is that we're using this for faculty, teachers, maintenance workers, cafeteria workers, athletic personnel, and all the individuals that are interacting with the students in a study of 300 individuals rather. And what we do is we give everybody a ring, a device, a ring that you wear, and also you upload the app. And what that does, allows us to monitor your heart rate, your respiratory rate, temperature, your fatigue, and other measures, and allows us to predict, like a weather forecast predicts 3 days in advance, if you're susceptible to having a viral illness.
Okay, so have you correctly identified any cases with this technology so far?
So what we've done validation where we can predict 3 days before the onset of an individual having symptoms of headaches, muscle pain, fevers, having shortness of breath and coughing, the symptoms associated with COVID or other viral illnesses. So we're looking at viral infections. And this will also become more important this fall when the influenza season comes on. So the goal is to detect the asymptomatic phase, individuals that don't have the presentation or manifestation of infections yet are infected and are thus spreading it. So this allows individuals to get feedback from the machine learning technology that allows them to be in the know and be smarter about the fact that they're going to have 3 days from now symptoms of COVID-related illnesses.
How many students are back on campus? Has the school year started yet, Doctor? And how many do you anticipate will ultimately return to school for the fall?
We're doing a phased return. We're looking at freshmen and those that are required to come back in person for laboratory training and other requirements. And it's been a phased return of freshmen and others. And we're looking at several thousand students that started last week, and the semester will end before Thanksgiving. But also it's important to look at the faculty, the teachers, and other service personnel who are interacting with the students, because they're also more susceptible to getting infected, especially from asymptomatic individuals. The key is this asymptomatic phase where you feel fine, yet you are spreading the virus. And our technology is detecting 3 days in advance the likelihood of you having symptoms associated with a viral infection.
Part of the college experience is not just living away from your parents and going to classes and taking more ownership of your education, but also the socializing aspect, Doctor. And we've seen some calls that students shouldn't be able to socialize for fear that kissing, sharing drinks will spread the virus. Where does your university come down on that?
So everybody has been undergoing training and awareness campaign from the time before you start to actually ongoing additional emails and texts and others for you to be aware that you can be without any symptoms, but you can be infecting others. So we're requiring wearing masks, washing your hands, social space distancing, limited gatherings, and also testing, putting together all that technology so that we can minimize the spread of the virus, and adding, in this case, a new technology that allows you to predict the presence of symptoms to see who's susceptible to getting the viral illness ahead of time 3 days from now. For example, today's Monday. We can predict on Thursday with an 80% chance who's going to have fevers or infection.
So, doctor, obviously you can predict it. Doesn't mean necessarily it will be entirely prevented at the university. There are also growing calls that if students get affected, faculty members, that they actually stay on campus. They don't go back to their designated communities anywhere across the country for fear of taking that virus from the university to those other communities. Where does West Virginia University stand on that? Would it keep students on campus if they do get infected?
Yes, so there are policies in accordance with the local state health policies and university policies for quarantining, isolation, contact tracing. So there are strict policies in place if someone is identified as having being infected, and also we want to empower individuals to seek medical care and be more in the know. But there's a very clear policy about quarantining and contact isolation.
All right, Dr. Ali Rezai, he's the executive chair of West Virginia University's Rockefeller Neuroscience Institute. Doctor, you're going to have to keep us posted on what this technology says. Thank you.